It's no fault of his own, but Danny Sands of Austin has spent plenty of nights on the floor.
Spend some time on the floor here in my apartment, and what I do to get into bed, I go alongside the bed and pull up the armrest and fall over.
Sands is 53 and uses a wheelchair due to cerebral palsy. He lives on his own and relies on state-approved home care workers to help him with certain daily activities, like getting up from bed and getting dressed. He has two such workers who have been with him for a long time, but although he's been long since approved for more service hours, he cannot find workers for the evenings, which is when trouble can arise. Sands is used to preparing and transferring himself from his wheelchair to his bed, but sometimes things don't go according to plan. At times, Sands has fallen and injured himself.
There were times when I call it the reverse turtle. I would be flat on my face, but I couldn't push around. I had my arms underneath me. I would land flat on my face with my arms underneath me, and my face was always turned so that I don't know if I would have been able to breathe.
Sands has gotten stuck off it enough that the firefighters he calls for help know him by name. For someone who has fought all his life to stay independent and has even survived cancer, that's hard for him to admit. He says that he and many other Texans like him cannot find the care workers they need.
There's scars when I didn't quite make it. It was my brother helping me. He saw me with my shirt off, and he said, "What the hell happened to your back?" So I had a scar. I'm not sure exactly how far it extends, but I got scratched up pretty bad. I have literally the scars on my body to prove the help that I need.
Sands is one of 300,000 Texans who rely on home care workers or community attendants to live in their own homes. The number of community attendants is also 300,000, but there's a disconnect between the groups. With the aging of the population and the workforce, and the influx of people from other states, community attendants are not able to meet the demand for their services. Their duties are crucial to so many lives, but the work can be difficult and there's little opportunity for career advancement. But a lot of the problem stems from low wages. Texas community attendants were paid the second lowest wages in the country. Most are paid through Texas Medicaid, and at last this year, the legislature finally raised their base pay. Last month, the new wage went into effect, going from $8.11 to $10.60 per hour. Will that attract more workers? I don't think the pay increases will have a huge impact, Danny Sands says. Longtime advocates like him are skeptical because even the boosted wage is uncompetitive with many other jobs offering higher pay for less training, and even job benefits. $10.60 can't compete with Chipotle offering an average starting wage of $15, while Starbucks and Amazon average $17 and $18 plus health coverage. Buc-ee's even offers paid time off and a 401k. For this reason, community attendants and disability groups continue to back a $15 level, going up to $17 in 2 years. So far, their calls for a special session to get it done have been ignored, but the problem isn't going away. Kathy Cranston, 64, of Austin, has been a community attendant for over 40 years. She leads the advocacy group, the Personal Attendant Coalition of Texas, representing thousands of community attendants across the state. She brings up a litany of attendants she knows who are in their late 60s and 70s, dedicated to their charges even through the dangers of the pandemic, but now getting injured and aging out, with no one coming in to take their places. Their median age is 48, with 36% being 55 and older. Without young bloods in the field, this public health crisis will worsen. We're just starting to see that some people are going to get institutionalized, or some people are just going to die, Cranston told the Austin American-Statesman. Institutionalization is frequently condemned by people with disabilities, where care is often understaffed and much more expensive to taxpayers. Sands knows this is true, because for a few years as a child, he was institutionalized.
When I remember talking to my mother, and she would say, "You gotta be able to take care of yourself. You can't rely on anybody else. Once I'm gone, you're gonna be on your own, and you can't. Your brothers are gonna have the life of their own." And very much of a can-do attitude. That it was, don't say you can't, say you can. Never say you can't.
So Sands fights to stay independent, and Cranston and the community attendants fight for a sustainable wage. and they all keep piling on the scars.